9 early signs of prostate cancer. Be honest, how many times have you brushed off a health issue thinking it's nothing serious? That's exactly how prostate cancer sneaks up on men. Did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? And yet most men miss the early warning signs until it's too late. But why does prostate cancer occur? Can it be cured? The good news: yes. When caught early, survival rates are over 98%. But that only happens if you recognize the signs in time. Today, we're breaking down 9 early prostate cancer symptoms you should never ignore, especially number 6 and 8, because most men don't notice them until it's serious. We'll also briefly discuss why prostate cancer occurs, but we'll be focusing more on the signs. Prostate cancer occurs when cells in the prostate gland begin to grow uncontrollably. While the exact cause isn't fully understood, several factors can increase the risk, including aging. Risk increases significantly after age 50. Hormonal imbalance. High levels of testosterone and DHT may fuel cancer growth. Genetics and family history. If close relatives had prostate cancer, your risk doubles or more. Chronic inflammation or prostatitis. Long-term inflammation may damage cells, leading to mutations. Diet and lifestyle. High-fat diets, obesity, and low-fruit vegetable intake may increase risk. Environmental toxins. Exposure to pesticides, chemicals, and heavy metals may contribute. Smoking and alcohol. These may fuel inflammation or interfere with hormone balance. DNA damage in aging cells. As men age, their body's ability to repair damaged DNA declines, increasing cancer risk. But why are these signs easy to ignore? Most of these symptoms develop slowly and don't seem serious at first. Many men just assume they're part of aging, stress, or minor health issues. But prostate cancer is highly treatable when caught early, so noticing these signs sooner rather than later could save your life. If you've experienced any of these symptoms for more than a few weeks, it's a good idea to see a doctor. Early detection means better chances of treatment and recovery. Starting with one of the most common yet overlooked symptoms. Sign number 1. Frequent urination, especially at night. Are you waking up multiple times to pee? You're not alone. Many men think this is just part of aging. But if your sleep is constantly interrupted because you feel the urge to go, your prostate may be pressing on your bladder. A growing or cancerous prostate can make it harder for your bladder to fully empty, making you feel like you need to go again soon after. If this is happening night after night, don't ignore it. Sign number 2. Difficulty urinating, struggling to start or stop. If you have to stand at the toilet for a while before urine starts flowing, or if the stream is weak and stops mid-flow, your prostate may be blocking the urethra. Some men also experience a dribbling effect, where urine keeps leaking out even after they think they've finished. This happens because a growing prostate can squeeze the urinary tract, making it harder for urine to pass through. Many men shrug it off as nothing, but persistent difficulty urinating is a red flag that something is blocking the pathway. If you find yourself pushing harder to pee, or it takes longer than usual, it's time to get checked. Sign number 3. Pain or discomfort during ejaculation. Pain while ejaculating isn't something most men expect. Intimacy should be enjoyable, not painful. However, some men experience a sharp, burning, or throbbing pain during release. This could be due to inflammation or pressure from an enlarged prostate. If you're starting to avoid intimacy because of discomfort, don't just hope it goes away. Changes in how your body responds to these moments could be an early warning sign of prostate issues. Sign number 4. Decreased semen volume. Have you noticed your ejaculations seem less intense or that there's less fluid than before? That's because the prostate produces most of your semen. If cancer affects its function, semen volume gradually decreases. Many men overlook this because it happens slowly. But if you feel like your orgasms are weaker or your semen output is lower than usual, your prostate may not be working as it should. This can also be a sign of other conditions like benign prostatic hyperplasia, BPH. Sign number 5. Blood in urine or semen may appear pink, red, or brownish. Seeing blood in your urine or semen can be terrifying, but if it happens once and goes away, most men tend to forget about it. Big mistake. Blood, whether bright red, pink, or brownish, could mean that your prostate's blood vessels are affected. This can also be caused by infections or kidney stones, but if you notice it more than once, don't brush it off. It's a sign you need to see a doctor. Sign number 6, pelvic, lower back, or hip pain. Persistent pain without an obvious cause. This is one of the most overlooked signs of prostate cancer. Pain in the lower back, hips, or pelvis. Most men assume it's just aging, muscle strain, or arthritis, but persistent pain that won't go away, even with rest or painkillers, can be a sign that prostate cancer is spreading to nearby bones. If you have deep, aching pain that lingers and gets worse over time, don't ignore it. It's better to rule out serious causes. Sign number 7, unexplained pain in the groin or testicles. A dull ache, pressure, or mild throbbing in your groin, testicles, or the area between your anus and scrotum, the perineum, is another warning sign. Some men describe it as heaviness or discomfort rather than sharp pain, making it easy to dismiss. But your prostate sits right between your bladder and rectum, and if it's inflamed or cancerous, it can create a deep, nagging pain that won't go away. If you found this video helpful, don't forget to give it a like, share it with someone who needs it, and subscribe for more life-saving health tips weekly. Sign number 8, difficulty sitting for long periods. Ever feel like sitting down is uncomfortable, even on a soft chair? If you constantly shift around, feel pressure in your lower pelvic area, or get relief when standing, your prostate might be swollen or irritated. Some men say it feels like they're sitting on a small ball or cushion. If this discomfort is new or getting worse, don't assume it's just bad posture. Your prostate may be the problem. Sign number 9, unexplained weight loss or fatigue. Losing weight without trying. Feeling drained all the time, even after a good night's sleep. When cancer spreads, it affects your metabolism, making you lose weight and feel weak. If you lack energy, feel exhausted all the time, or have no appetite, it could be more than just stress. Pay attention to your body, especially if you're experiencing any of the other symptoms on this list.